All righty. Good morning, everyone. I'd like to welcome to our, what is today? The 25th. Our regular BOCC meeting for the 25th of January, 2023. Before we call the roll, Mr. Hale, would you provide an invocation and lead us in the pledge?
Morning, Commissioners. If you would bow, please. Father, we just are so thankful that we live in a free country, and Father, we thank you for the many blessings that you've given us, for your love, your mercy, your grace, and for your Son, Jesus. Father, we pray that you would bless these proceedings, those in attendance. Lord, we pray that you would grant the Commissioners wisdom, that they would govern wisely, and those of us that are in positions of leadership, that we would lead by example and be good stewards with the people and things that you place in our care. Father, I just pray that you guide us and direct us this day. I pray that we would glorify you through our thoughts, our actions, and our words. These things we pray in your Son's precious name. Amen. Pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Okay, the time is now 9:04. Amanda, could you call the roll, please?
Commissioner Richardson?
Here.
Commissioner Thayer? Commissioner Schroeder?
Here.
All righty, thank you. So we are down one commissioner today. So as chair, I can't make motions, but I can second. So you're probably going to hear a lot of motions from Dallas today. But first item we have is approval of the agenda. I'd accept a motion.
Mr. Chair, I'd like to make a motion to approve the agenda as presented.
I'll second. We have a motion and a second to approve the agenda as presented. All in favor, please say aye.
Aye.
Aye. Motion carries. First item of business we have is approval of items on consent. I'd accept a motion.
Mr. Chair, I'd like to make a motion to approve the consent items as presented.
I'll second. We have a motion and a second to approve the items on consent. All in favor, please say aye.
Aye.
Aye. Motion carries. Next item up we have is any reports from elected officials or department heads. Do we have anything from elected officials? Sherry, what's new in the Treasurer's office?
Good morning, Commissioners. Sherry Hewlett, Elbert County Treasurer and Public Trustee. I submitted my fourth quarter Public Trustee report, and as you can see by the numbers, fourth quarter foreclosures stayed about the same as 2021. Releases were way down. So just the way our economy is going, it looks like foreclosures are going to pick up more than the refis and payoffs on homes. So hopefully for 2023 that's not the case, but it kind of looks like that's the way it's trending. I anticipate transferring around $20,000 to the general fund. So that will happen after you sign and the fourth quarter report is recorded. As far as the Treasurer's office, where everything's running smooth, tax notices I approved the proofs last week, so citizens can expect to get their notices in the mail. I'm probably this week, first part of next week, so be on the lookout for that. If you have any questions or problems out there, please give us a call. So anyway, just wanted to update you on that. Big thanks to my staff. Michelle Ingersoll and Beth Barnes are working really hard, and I really appreciate all they do. So, any questions?
I have none. Do you have? No.
Okay.
No, thank you, Sherry. All righty, at this point I'd open for open public comment. Amanda, did we have anybody that wanted to be called or any email comment?
No, we don't.
Okay, thank you. Do you have anybody in the room that would like to make comment? Seeing none, we'll close public comment at this time and move on to discussion items. The first item we have is a discussion of a resolution regarding building permit fees. Welcome.
Good morning, Commissioners. So I put forth a resolution to amend, I guess, Resolution 20-08. The first part of it states that annually in September, we should amend the building department fees. So I went ahead and went forward with that. I discussed it with Bart, and he said that we could go ahead and implement those fees, but this was more of a formality to come through this process, as it is already, I guess, decreed that we shall do it. So, Dallas, I did amend that page
Very
to
good.
get you on it correctly. I just have not sent that over to Amanda yet.
That's fine. Thank you.
Excuse me. Really just implementing a standing procedure that.
Correct.
So,
Yeah, so as you can, hopefully it's all attached. The building valuation data I pulled was from August of 2022 from the ICC, and that's what I built the new table off of.
okay. And these fees would go into, new fees would go into effect upon our approval, or
I
is there?
believe they already in effect.
Okay, this is just a
So
really
if I
ratification.
can interject,
Yeah,
back in 2020, the board gave the authority and approval and essentially the direction to update these regularly. So the authority's already been granted. It's just that since we're now with a new group of commissioners and we have the ability to essentially do a new resolution, it's just kind of a formality at this point to essentially reauthorize that ability moving forward.
Essentially just ratifying or continuing a process that we've had. Yeah. If that being the case, I don't think there's a reason to wait till our next meeting just to take it action, because it's already enacted. So if you don't have a problem with that, I'd accept a motion just to approve the resolution, the corrected resolution as presented.
Do we need to move it to action first, or just by motion, or just go for it?
I think we just go for it.
Mr. Chair, I'd like to make a motion to approve Resolution 23 TBD, a resolution amending building department fees in the currently adopted 2018 IBC and 2018 IRC.
I'll second that. I have a motion and a second to approve the resolution with the number to be determined. All in favor, please say aye.
Aye.
Aye. Motion carries. All right, next item up is just an update on our 2021 final audit. We'd placed this on the agenda in the hopes that we would have that complete and ready to accept today. There's still some final work being done by the auditor, just to kind of refresh everybody's memory. Generally audits are due by the end of June, and generally we have them approved and presented by the end of June. Unfortunately, in the late April-May timeframe, we had a key person that was hospitalized for several weeks and was unable to get some work completed. We did request and were granted an extension for the audit through the end of September. Just there were delays in that point, just scheduling with our auditor who had moved on to other clients, as well as the departure of our county manager and finance manager during that same general time frame. For the last several months, it's really been things outside the finances that have held things up. We've had to contact each of our creditors and get a letter just acknowledging the fact that the audit was late but would be turned in, and in every case they had no concerns with it. Some of those letters expired at the end of the year. Our auditor still wasn't finished with the work at that point, so we've had to go back out to get new letters. We did receive a draft of the audit report on the 19th for discussion purposes. It indicates that we'd have an unmodified opinion, that the finances as reported were materially correct in all respects. So we don't expect anything different to come out of the final report. We just need to get that final report out through the auditor. My understanding is they've got everything they now need to complete the work at the auditor level. Then it passes through a QA/QC process with a different partner in the same firm to kind of check their work before it comes back to us. So we are, once again, kind of hoping by the next meeting, we'll have an audit to accept. If we get it prior to that, we may schedule a quick special meeting just to get this buttoned up for the year. So I think at the meeting where we presented and adopted our budget and appropriated for the year, our intent was, even though the timing was off, to keep the sequence straight and submit audit before we submitted our budget for 2023. But that deadline for budget submission is coming up on the 31st of this month. So if we do not have the audit by that point, we will submit the budget as required statutorily and move forward and get the audit in as quickly after that as possible. But that's kind of where we're sitting now. And again, kind of looking forward to new county manager as budget officer showing up on Monday and passing on some of these things to kind of push along to him. So anything from your end?
Oh, I just know it's frustrating for everybody, the situation we're in, but some things sometimes get out of your control, and you know, certainly get the people in place for this year that certainly don't want to repeat where we're at now.
It's an opportunity to learn a lot that we probably didn't know. So with that, if there's any questions on this item, we'll take them. Seeing none, we'll move on to discussion of the 2024 Elbert County Commissioners' budget goals. Again, each year for the last 6, we've issued budget guidance early in the year, generally end of January into February. So just kind of shapes what we're looking for as commissioners in the budget for the following year, and a little bit of guidance as it's built. And included in the packet is last year's budget goals, and kind of the intent after this was to get the budget steering committee together to review the goals that had been given last year, to just kind of get their input as to what was useful in the guidance, what might have been more useful to have, and we'll take it from there. Last year, we give several assumptions. Last year, we assumed a 10% increase in medical benefits. I think it was about 6. Our casualty and property insurance, we'd anticipated a 50% increase. It came in at about 43. And population increase was about the 2% that was indicated. But really, this is to put some guardrails on where we're going with the budget. So, anything from your end?
Nope. Looking forward to jumping into the weeds with it.
Okay, so we'll get this out to the members of the budget steering committee and ask them to meet sometime before the next meeting and get us some feedback, and hopefully have some final goals that probably review a draft at the next meeting and then go final at the second meeting in February. Any public comment? Seeing none. The next item we have is the second amended and restated intergovernmental agreement for ambulance secure transportation licensing and inspections. Bart.
Thank you, Commissioners. Bart Greer, County Attorney. As far as this is concerned, the county has been part of an intergovernmental agreement with multiple counties to have Jefferson County essentially do the ambulance licensing and inspections, those sorts of things. That's gone on for several years, and they have the ability to inspect certain ambulances and ambulance services to ensure that they meet all the criteria needed to do medical transports. There's all kinds of things that they need to review for that, and so we essentially farm that out to Jefferson County. There's a new component to it that was added recently, and it's something that the legislature has been working on at least since 2020. But in particular, not only for just regular medical transport, there's been the belief and observation that this push for mental health care and transport for mental health care has sometimes left rural communities with only the option to either use an ambulance to transport folks for that type of service and perhaps be without an ambulance in the area as a result of that, or to look at other alternatives. And so the other alternatives are the secure transport aspect to this bill, which allows certain services that are maybe perhaps not an ambulance per se to be able to do some of those mental health transports as opposed to an ambulance or a patrol car. And so it does provide another option for that, and it was adopted by the legislature, is now part of the regulations that each county has to look at. So with that, the intergovernmental agreement that we have with Jefferson County will not only kind of take over the review of the ambulance licensing, but also of the secure transport aspect to that. So that is now part of the intergovernmental agreement that we have with Jefferson County. And so it is something that I am requesting, because essentially we should have had something in place in January 1, and we were still waiting on the final language for this. I would recommend adoption. I'd ask the board to consider moving this to an action item, and I would also request approval for this particular IGA. Thank you.
Thank you.
So Jefferson comes out and does physical inspections, or
They go to Jefferson County.
they take them to Jefferson County? Okay.
I know there's been a lot of discussion. I mean, this is Adams, Arapahoe, Boulder, Douglas, Jefferson, and Broomfield along with us. So I know everybody was just striving to get this done by the end of the year, but I think just the timing of all the different board meetings and getting corrections, and then different counties making recommended changes at what was generally the last minute kind of drove this back. So if I guess I'd open for public comment if there is any. Seeing none, I would accept a motion to take this to action and approve the IGA as presented.
Mr. Chair, I'd like to move to approve the second amendment and restated intergovernmental agreement for ambulance and secure transportation licensing and inspection.
I'll second that. We've got a motion and a second. All in favor, please say aye.
Aye.
Aye. Motion carries. All righty. Moving on to our planned action items. The first item we have is the minutes for the January 11th, 2023 meeting. That was our regular meeting and our organizational meeting for the year. I'd accept a motion to approve as presented.
Mr. Chair, I move to approve the minutes from the January 11th, 2023 meeting and dispense with reading of those minutes.
Okay, we have a motion and I'll second. I'll second. Now we have a motion and a second to approve the minutes as presented and dispense with the reading. All in favor, please say aye.
Aye.
Aye. Motion carries. All right. The next item we have is a resolution to certify cost for prosecuting crimes. This is reimbursement associated with activities in the 18th Judicial District. Very small amounts. Generally, it's just when somebody is required to pay some sort of restitution towards the cost of their crimes, which isn't often it's collected, then it's dispersed amongst the 4 counties. And being a smaller county, that's a pretty small amount, but it's just kind of a finishing up the paperwork for the year type thing. Is there anything that you'd like to add?
No, this is an annual thing that we look at, and I think that's a pretty good summation of what this is. Sometimes there is no money that we're going to receive back. Sometimes I suppose it's possible we could be potentially paying money out, but we get a small amount back this year as a result of how things shook out financially. And so essentially what's being requested is just to certify receiving this money, and it's a fairly small amount, but it's kind of a formal process that we do need to go through on an annual basis. So I would recommend approval of this particular item.
Yeah, it's an amount of $3,513.35. I guess if there's no public comment and I don't see any, I'd accept a motion to approve the resolution as presented.
Mr. Chair, I move to approve resolution number 23, TBD, a resolution certifying costs of prosecuting crimes alleged to have been committed by persons in the custody of the Colorado Department of Correction.
A motion, second that. So now we have a motion and a second. All in favor, please say aye.
Aye.
Aye. Motion carries. Next item up is consideration of a resolution authorizing the county clerk to enter into IGAs and MOUs for the 2023 elections. I'll defer to my colleague to describe what this is.
Yeah, this was something I found very beneficial when I was clerk, when we started doing this, allowing the clerk to enter into these agreements prior to elections. We, in the past, would have a hard time getting everything together in a timely fashion. There are certain deadlines when these have to be in place, and it just streamlines things for the clerk to be able to enter these agreements. So it's been a real benefit to have this IGA in place, or this resolution in place.
Thank you. Do we have any comment on this? Seeing none, I'd accept a motion to approve the resolution authorizing the county clerk to enter into IGAs.
Mr. Chair, I move we approve Resolution 23, TBD, a resolution authorizing the Elbert County Clerk to sign election IGAs and MOU agreements.
I'll second. So we have a motion and a second to approve the resolution authorizing the clerk to enter into IGAs and MOUs for the 2023 elections. All in favor, please say aye.
Aye.
Aye. Motion carries. Okay, final item of business we have this morning is consideration of approval of the Elbert County 2022 HUFT inventory. Generally, this is our inventory of roadways that we provide to the state to support receiving our fraction of the gasoline taxes that are collected.
It is. Commissioner Rory Hale, Director of Public Works. There were a few changes in the HUFT report, and before I get into this too far, I want to commend Bailey Short for the work that she did. Coming into the position new with very little to no training because the rest of us are ignorant. She's done a great job. Basically what we'll do once we get the signature page, we'll get this submitted to the state so they can upload it on their website. So thank you, Bailey. Okay, I think you're familiar with what HUFT is, but I'll go ahead and go through this. The Colorado Highway Users Tax Fund is primarily the source of revenue Elbert County receives for maintaining the county's transportation system. Approximately 75% of the revenues come from fuel taxes, vehicle registrations, and various fees paid to the state. The remaining 25% comes from driver's license fees, court fines, and interest. Approximately 11% of the funds go to the Colorado State Patrol and ports of entry. CDOT receives 65%, and the remaining 24% goes to cities and counties to fund their transportation needs. HUFT funds are distributed to cities based on the number of motor vehicle registrations and non-state road miles traveled in those cities. The HUFT funds distributed to counties are based on vehicle registrations, non-state road miles, and the size of bridges within those counties. Last year, we received roughly $2.7 million. It's kind of hard to say what we're looking at for this year. At this point, it's probably going to be in the same area. We'll wait and see. Right now, we've got roughly 460 miles of arterial streets, 796 miles of local streets, 1,257 miles of HUT eligible streets, 82 miles of non-HUT eligible streets maintained by others, and then 84 miles of non-HUT eligible streets not maintained. I think you know that each incorporated township or town in Elbert County, Simla, Elizabeth, and Kiowa receive HUFT funds as well. Granted, it's a pretty minuscule amount in comparison. It does help. You know, we happen to be lucky that we have a dedicated sales tax, but this really helps us offset some of the cost to maintaining a county that's 1,800 square miles. So if you have any questions?
I do not. Nope, and again, I'd echo Bailey, good work. I mean, there's a lot more to it than was presented, and yeah, when you look at every road segment, where it begins, where it ends, what it is, when it was built, etc., there's a lot of, I know there's a lot of information to pull together, so much appreciated. Thanks. Have any public comment on this item? Seeing none, I would accept a motion to approve the Elbert County 22 Huft inventory.
Mr. Chair, I'd like to make a motion to approve the Elbert County 2022 Huft inventory as presented.
I'll second. We have a motion and a second to approve the 2022 Huft inventory. All in favor, please say aye.
Aye.
Aye. Motion carries. All righty. Board planning. Said let's definitely keep the 2021 audit on for the next, as well as discussion. We should have the draft goals and response from the Budget Steering Committee to look at for our next meeting. Along with, should be getting an update during staff reports on the construction of the new Public Works facility. You have anything specific you'd like to hear? Okay, that gets us going. Obviously, minutes from this meeting. So, alrighty. This afternoon, or excuse me, actually, the next item of business we have isn't till a specific time, and that was our Board of Health meeting, a quarterly meeting that is required by statute. So we have no business until then. So it's 9:30, we're in recess. So. Be nice if Well, good morning and welcome back. We're coming out of recess from our initial session and formed as the Board of Health. So it's 11:01. Amanda, could you call the roll, please?
Commissioner Richardson,
Here.
Commissioner Thayer, Commissioner Schroeder,
Here.
Grant couldn't join us today. He's had a procedure on his hand earlier this week, but he sends his regards. This might be one of the few meetings he's missed in 6 years. But with that, this is our quarterly Board of Health meeting, and I will turn it over to Dwayne Smith, our Director of Public Health.
Thank you, Commissioner. Welcome, everyone, citizens listening in, folks in attendance today. Dwayne Smith, Public Health Director for the county, here to provide a quarterly update on our activities. Regarding the agenda, I do want to add one item to the agenda. That is an update on the recently received drinking water project needs assessment for the Agate Water Authority. I'll fit that in somewhere in the environmental health updates. Again, just level setting. Our video went out momentarily. There we go. Okay.
Should be the last time we've got some wireless devices in order that will.
Here's a look at our foundational public health services that we're striving to build. The first item is a request for an increase in our per capita allocation. So by way of background, in 2008, the General Assembly passed the Colorado Public Health Act, intended to improve the performance of local public health agencies across the state. In a nutshell, it defined the duties and responsibilities of a local public health agency, established minimum qualifications for directors, for people serving in my role, core public health services, minimum quality standards for those services, and a funding formula. So in 2008, the General Assembly established a per capita minimum of $1.50 for each citizen in each county. Common examples of how that per capita allocation is put to use in local health departments are emergency preparedness coordinator, environmental health specialist, epidemiologist, and so on, as you can see on the list here. The green checks represent positions we have in place currently. The red checks represent needs. Some of them are current needs, some of them are future needs. Some of them we are, how can I characterize this? Managing through partnerships with Douglas County Health Department. So that would be the case of the nutritionist who is needed for nutritional assessments for people enrolled in the Women, Infants, and Children's program. That is typically a registered dietitian. Through our partnership with DougCo, they are fulfilling that role for us.
Are we still advertising for a shared epidemiologist? Or?
We are not. We are not. So we interviewed some folks, didn't find an ideal candidate last fall, September-ish, and we got, quite frankly, simply busy with other things and put that on the back burner. Currently, the epidemiology role is supported through what's called a regional epidemiologist through the state health department that serves several counties. I don't know exactly how many, primarily in eastern Colorado. And they are a remote worker working from the other side of the metro area. And in fact, some on the epi team don't even live in the state. So they are completely remote. A local epidemiologist will allow us not only to serve the health department, but given their expertise in numbers, analysis, I think it could be a resource to serve across departments as needed, particularly in the space of quality and process improvement for projects or department-wide initiatives, and even strategic planning for the county. The Emergency Preparedness Coordinator, again, that is, we're benefiting from the partnership with Douglas County Health Department. Of course, we have an Office of Emergency Management. The Emergency Preparedness Coordinator is specific to the public health realm and includes what's called or known as Emergency Support Function 8 within Emergency Planning and Preparedness. So again, not an immediate need, but as the county grows and over time, we'll want to bring that in-house at some point. So in 2008, and continuing through 2022, our per capita allocation is and has been $1.50. In last year's budget, our allocation totaled $37,709.50. That was based on 2020 census of 126 residents. During that time, of course, prices have gone up for everything. According to the American Institute for Economic Research, inflation is about 36% over the last 15 years. So, respectfully requested, beginning with next year's budget, I'd like to request a per capita allocation aligned or reset, if you will, based on the rate of inflation. That would bring the allocation for next year from $1.50 to $2.04. The net difference for that increase is $17,631.62 for a new request projected at $55,341.12. And happy to answer any questions or provide any context to this request.
Just a couple questions. I have to catch up on stuff, you know. On the previous page, partnerships with Douglas County Health, are they just being friendly neighbors, or are we sending them a check?
They are, first and foremost, being good partners and friendly neighbors. When they apply, for example, to CDPHE, to the state, for the WIC program, or also in the tobacco program, and in emergency preparedness, their application includes a scope of work to include Elbert County. So they are allocated an additional amount of money on top of their work for Douglas County. Frankly, it is very financially advantageous to us in Elbert County Public Health. I believe, I know in the example of the tobacco program, if we were to do our tobacco prevention, cessation programming on our own, I want to say for the next fiscal year, we would have received, I want to say $52,000. It would be really hard for us to hire an FTE and pay for benefits on $52,000 for that scope of work. I want to say when Tri-County Health Department supported our emergency preparedness, and this is a ballpark figure, I want to say they got an extra $40,000 to support Elbert County. So again, not something we could, we'd have to come off the hip for some additional funding for that. So on top of that, the expertise provided and the experience provided by Douglas County Health Department personnel, one of whom their emergency Their Director of the Office of Emergency Management is actually an Elbert County resident, John Surbeck. So he knows the county. He knows, you know, infrastructure. I believe he's served on Planning Commission, yeah. So, yes, so hopefully that provides some
Yeah, thank you.
good context.
That's good. I mean, if they're, I think their population's somewhere north of 360,000, so adding 7,000
Exactly.
isn't a big lift for them compared. So it's good to have good neighbors.
Send him a Christmas card.
And then on your, yeah, we'll print something. Yeah, in terms of the per capita, your timing is good because we just started discussing our draft budget guidance for 2024, and we'll try to have that complete by the second meeting in February. So this is a good insert to look at that as a potential general fund transfer and see where it shakes out. Does not seem unreasonable. $1.50 a person is pretty.
I felt it was pretty reasonable, so thank you for agreeing. All right, any other thoughts or questions? Okay. Communicable disease updates. Thankfully, hopefully we're in the last gasps of COVID, other than the virus will continue to circulate in the community, as does flu, colds, other things like that. And from the beginning of the year, I believe, we have no new hospitalizations to report. Our average positivity is very low, lower than the state. And for the last, excuse me, several weeks, I think probably at least the last 3 weeks, we've had less than 5 reported confirmed cases. So we're in good shape there. Just a quick overview of cases over the last calendar year. And again, emphasizing these are known confirmed infections. We can probably assume the actual numbers are probably anywhere from 50 to 60% higher, but heavily weighted to the beginning of the 2022 calendar year in January and February. We've been in really good shape since last spring and have continued. So the lion's share of these cases were about 12, 13 months ago. And there you can see we're almost flatlining on current cases. Looks like I didn't provide an update on flu and RSV. And I have a note here. They're also sharply down, is my brief note. So we're in generally good shape across the board. So environmental health updates. Our team, Stacy Reinhardt and Marissa Ginger, they issued 662 permits last year. Our septic revenue was consistent with 2 years ago and before. I think last year it was higher than the 168,574 listed. I think that was just a boom year. Food licenses are up slightly. Food revenue is consistent with where it should be. And there you can see the permits issued for septic tanks, brand new, repairs, and just use permits. Stacy continues to do a good job with the field work and continues to remain busy. I think I probably shared with, I think at least Commissioner Schroeder yesterday when we chatted, at some point as the county continues growing and more people are building houses that are not part of a wastewater system, we'll either need to contract with an additional septic inspector, or, probably in 5 years, we'll need to hire another one. Hopefully, in the meantime, we can contract that work out on a PRN, part-time basis, or as-needed basis, so. But it's a good challenge to have. It's important to note that the environmental health program is self-sustaining, and more than self-sustaining. So their revenue above and beyond personnel and supply costs goes back into the public health fund to support other aspects of the health department. So it would not, if we went to a contract, part-time contract person for additional septic inspections, we could pull that out of existing revenue, would not necessitate additional ask out of the budget. Revenue last year, almost 162,000. You can see it's pretty consistent with 2020, not quite at 2019 levels. Some of it is seasonal, a lot of it is seasonal. Some of it is weather related, so it ebbs and flows. And again, I think 2021 was just a banner year. I won't belabor the food licenses. Revenue was up a fair amount percentage-wise, and our best year in the last 4, consistent with new restaurants in the county. Vital Records, I want to recognize our Vital Records team. So Lisa Helseth, Marissa Ginger, Sarah McIntosh. Lisa and Sarah are here. They're doing a great job. This is a very detailed process. These are legal documents that are very valuable. And since we resumed Vital Records operations in January of 22, we're doing really well. Not a huge cash cow. How much is the death record?
I think it's on the next slide.
Is it?
Oh, the death records. Each birth certificate is $20 for the first copy, $13 for the second, and it's the same.
So the birth and death certificates, $20 for the first copy, $13 for each additional copy. And occasionally someone will come in and want 10, birth records for a variety of filing reasons. Again, not a cash cow, but more than covers the cost of the staff time. How long would you say it takes to issue a record?
There's no issues, and we're able to find the record on the portal about 15 minutes.
Okay. Our Vital Records team was recognized by CDPHE as one of only 17 offices statewide that scored 100% in 2 compliance reviews over the last 6 months. Again, it's basically an audit, a records audit, to ensure that every T is crossed and every I is dotted and all the information is correct. Our biosolids, understandably dialed down with colder weather. Again, these applications are almost exclusively in the very far northeast part of the county, northeast of I-70. We continue to grow with our clinic operations. We've begun advertising in print, in the Ranchland News, on social media. I haven't checked whether we put anything on the county webpage yet. Trickle, yeah. One thing that will hopefully jumpstart visits, we recently completed our enrollment, I should say enrollment for Medicare. So we anticipate that a good portion of our patient clientele will be Medicare population. Currently, we have completed enrollment for Blue Cross Blue Shield, United Healthcare, Medicare. We just paid the fee for Medicare yesterday. And TRICARE. Yep. And we've got a couple more third-party payers in the hopper. But we were recognized by CureMD, which is the electronic health platform, patient record for successful implementation and go live. This last slide, and then I'll get to the update on the drinking water project needs assessment from Agate Water Authority. Just wanted to communicate that through all the challenges and tumult from, that accompanied the COVID-19 pandemic, our neighbors on three sides have had either new health departments to stand up or turnover. You can see the counties in yellow have had at least one health director vacate their role. The counties in red have had multiple turnovers. We've been consistent. We've been here to serve the community the entire time. So I think that's a point of pride that I wanted to emphasize. Just being here to serve the community. And then I'll transition to the added agenda item. The other day, I received the Drinking Water Project Needs Assessment from the State Water Quality Control Division. I want to thank and recognize Mark Dettenreeder in Economic Development for his he's done just great work in partnership with the Agate Water Association in helping them identify a plan moving forward to fix some of their challenges with their water tanks. Commissioners are most likely aware of the challenges. It's been ongoing with Agate for probably 3-4 years at least. I just went through the report and highlighted some things I want to share. On August 8th of 2021, Agate Water was notified of their water quality testing, that it showed total coliform level exceeding limits. Therefore, the system was out of compliance with Colorado codes and regs. CDPHE then issued an enforcement order. After receiving the enforcement order, Agate inspected its water tank, revealing multiple holes in the roof that are believed to be the source of the system contamination. To bring the system back into compliance, repair and restoration of the water tank is recommended. Restoring or repairing the existing tank presents the most feasible, lowest cost alternative to bring the system back into timely compliance. And looking at some of their challenges, they've had significant leadership transitions over the past 5 years. And there's been no formal budgeting and finance planning. Fortunately, they're working with the county and the RCAC to prepare a budget for 2023. Hopefully over time, they'll begin performing multi-year financial planning. Currently, they do not have complete updated financial records available. The report noted that their financial status is unclear at this time. I think it's safe to say it's not in great shape.
Essentially operating off a credit card, so
Yeah.
it's a private entity, so.
The existing facility limitations that were noted, the existing water tank serves the entire system and needs repair and restoration. The water meter pits, which include meters and connections to service lines, need to be replaced for at least half of the customer connections to the system. At the booster pumping sites, the pipes are aged and in poor condition. The fire pump needs to be rehabilitated or replaced, and controls need to be upgraded. They have 2 tanks. Tank number 1 is called the big well. Tank number 2 is called the little well. They are both sourced from groundwater. The well draws from the Kiowa Bijou Basin. The depth of the well is unknown. It is a permanent well. Near as I can tell, the system was built in 1970. So they're looking at going on 53 years, which is obviously contributing to some of the challenges. Currently, they're not tracking distribution system losses. Their water pressure is on the low side. Design criteria for the wells recommend a normal working pressure of the distribution system of about 60 psi, not less than 35. They're closer to 40 psi, and typically run between 30 and 40. Again, the distribution system includes water meters, but less than half operate correctly. Their number of equivalent residential taps is currently 38. Looking at their potential options moving forward, the first alternative is to rehabilitate the existing 140,000 gallon tank. Total project cost estimated to be $363,000. The second option would be to construct a new elevated storage tank of between 200 and 250,000 gallons. That total project would be estimated at $2.079 million. They would need, once they get to being ready to construct, they would need a temporary storage tank while the existing tank is taken out of service for restoration. Their project implementation timeline, they indicated March of this year to submit a loan application. Design plans, I interpret this as final design plans secured of January of 24. Putting out for bid in March of 24. Awarding a contract in May of 24, starting construction in June of 24, with completion in September of 24. I believe those are the highlights that I wanted to mention. I'm glad to see that things are moving forward, and certainly want to emphasize that reporting for information purposes and updates only. This is not pointing a finger at anyone. They're doing the best they can with what they got. Unfortunately, they don't have much to work with.
Yeah, I know from talking on Mark's side, where they're really hurting is they're a nonprofit private entity, so they can apply for loans, but not grants. So there is some discussion about reforming as either a local improvement district or some sort of district that would allow them to seek grant money. I mean, even the
And that is mentioned in this report.
$360,000 project with 38 taps with I mean, it's over $10,000 with interest per tap over some period of time.
To the extent that is possible, if there can be conversations had with our congressional delegations to potentially put an earmark in a bill, in an infrastructure bill of some kind, to get some funding, I think that would be welcome.
Yeah, definitely. We'll stay engaged. We're trying to kind of keep DOLA as sort of the lead and trying to help them, because it's where the money is. But yeah, I'm be interested to see how the loan application goes when you really don't have the ability to generate funds to pay a loan.
Sarah and Lisa, do you want to share anything? Any updates? Notes?
I don't think so.
Okay, hearing none. That's our report.
Alrighty, one thing I had, I just saw the communications back and forth and the renewal of Dr. Duvall's, contract as the medical officer. Any hiccups there, or do you anticipate that'll?
I need to get the contract to him. The county attorney reviewed it and made some minor edits. Just need to get it to him for the first signature, and then we'll pass that through for your signature, my signature.
Okay.
So don't anticipate any hiccups or obstacles there.
Cool. Anything on your end?
I just want to say thank you for showing me around yesterday, bringing me up to
Absolutely.
speed on everything. I really appreciate it. And just as a side note, I really appreciate the vital records coming back into the county. That was a big thing over at the clerk's office with motor vehicle. People are trying to deal with a death and then having to be sent a long ways away because we have to submit that certificate with the vehicle changes. It's a big benefit for our citizens to have that locally. So really do appreciate that.
Great. Yeah, we're happy about our progress, so, yeah, thanks.
Please pass on our thanks to the whole team, but thank you guys for all you do. Don't believe we have anything else. I'd ask for public input.
John?
Right, so, yeah, if you want to huddle with John afterwards, that's fine, but I'd say it's 11:32, we're in recess. We'll be back at 1 to consider a land use item, but thank you much, folks.
Thank you.